Okay.
We are streaming. Go right ahead.
All right, let's do it. Let's do it then. Are you ready for me to begin the meeting? Well, good morning, everyone. I'm Senator Emmett Hanger from Augusta County, Senator from the 24th Senatorial District, and I'm joined by a number of my colleagues who we will introduce shortly. This is one of 4 virtual meetings that we're having around the state. As most of you are aware, we are required by our rules, and it's obviously just a good thing to do prior to the beginning of each session. Once we've had an opportunity to review the governor's presented budget, we take that up, and then we have budget hearings around the state. This particular one, this is our first time, of course, doing it virtually, but is for Western Virginia. And hopefully we will have a number of presenters that will be succinct in their presentations. We have members of both the House and Senate. We are required by law to hold a series of public hearings on the governor's proposed budget to give all of you, the citizens of Virginia, the opportunity to comment on specific issues of concern to you. Today is your opportunity to talk, and our job as legislators, and this is something that's hard for us to do, we're just supposed to sit here and listen. No, so you won't be hearing much from us, and obviously we have time constraints, but you won't be hearing much from us. We will be sitting here listening to you, taking notes. I have the other legislators, and I'd like for staff to call out the name of the other legislators now, and to have them give them an opportunity to introduce themselves and the districts that they represent.
Thank you, Mr. Chairman. I will go through the House members first. If you could be ready to unmute and allow your video if you care to. Delegate Hurst.
Hi, yep. Delegate Chris Hurst, representing Blacksburg, Montgomery County, Radford, Pulaski, and Giles County.
Delegate Ferris. Are you able to unmute yourself, Delegate Ferris? I will come back. Delegate Austin? All right, still not getting audio for him. Senator Edwards, are you ready? For the members, you will need to unmute your own self before we can hear your introductions. We'll go through, try one more time. First with Delegate Ferris. And Delegate Austin. Senator Edwards.
Okay, Sarah, we'll go ahead. This year, we of course changed the format and the public hearings, which usually we hold them in person, but we're doing it virtually today because of the coronavirus pandemic. And you can see, we've got it's a little awkward for us. We do have several other members that are logged in now, so I know they're out there, but they haven't been able to communicate directly with us as we answered our roll, but I'm sure they will be available to listen to your comments, they and members of their staff, as the comments are made. I'm going to start by going over a few simple ground rules that will help the hearing go smoothly, and at the same time, give everyone an opportunity to be heard in a responsible fashion. First, when you signed up to speak, you received an email with a Zoom link for the hearing. As of this morning, the House Appropriations and Senate Finance and Appropriations Committee websites were updated to include a listing of each speaker who signed up to speak, along with a number. That's the order in which you will speak. Staff will from time to time call out these numbers along with the name from the sign-up list to give you an idea of how far we're down the list. If you're not present at your time to speak, for whatever reason, we will allow you to speak at the end if you are still available. As we get closer to your number, staff will move you from the waiting area into an actual meeting room so that you can speak. However, do not speak until your name is called. Remember, as some of us don't remember sometimes, to unmute yourself as soon as your name is called to minimize transition time. And this is important. Try to limit your remarks to 3 minutes or less to be courteous to everyone that wants to speak. That way we can be heard, and all of you can be heard in a reasonable amount of time, and no one will be left out. We will stay in the meeting until the last speaker that registered has spoken, but no later than 4 p.m. And I'd have to share, if we're still going to be here at 4 p.m., I'm going to be in favor of taking a siesta about 2:30. So you might have a time to lay your head down and refocus. Please remember, near the end of your 3 minutes, a timer will sound. So please wrap up your comments at that time. After you've completed speaking, staff will move you back into the waiting area where you can continue to watch the hearing or leave altogether. And finally, to hear as many issues as possible and to be respectful of the time of the others in the audience, we ask that you avoid duplication if possible when testifying. I can tell you from years of experience that repeating, excuse me, I got to get all my technology silenced here. From years of doing this, that repeating things actually is not as effective as kind of summarizing and tailoring your remarks to something that we've not already heard. We hope that each of you will have something new to say today. We certainly will be listening to learn from your comments and to get a grasp of what you think is important as it's included in the governor's introduced budget, or with initiatives that are not included in the governor's budget that you want us to focus on with our limited resources. So with that, staff will now call out our first speaker, who's number 1 on the list. Thank you.
Thank you. The number 1 speaker is Margaret Maxey. You could please go ahead and unmute and allow your video, Ms. Maxey. You'll be followed by number 2, Janet Settle.
Okay, Margaret, we see you.
Good morning, and thank you for letting me speak. My name is Margaret Maxey. I live in a group home in Bedford, managed by Encircle. We used to be Lutheran Family Services of Virginia. I want to tell you why it's important to use the state money for services that help people like me. I lived here for 7 years. Before I lived in a group home, I had nobody to talk to, no friends, and no social life. My weight was up and down. I lived on an unhealthy lifestyle and I had unhealthy relationships. Since moving to the group home, my friendship has gotten stronger. My attitude has changed from not caring for anybody or anything to being excited about my friends and family, my life. And now I spend time with people that I love, and I am around people that I know that care about me. And I'm able to get a job. I was able to get a job, great job that I enjoy, working with people that was fun to be around. I also earned a good paycheck and making a difference in other people's lives. And I look forward to getting the same job back or a different job in the future once this pandemic is over. Thank you. Please support the pay raise for community coaching and engagement that help people like me get out into the community to work, meet new friends, and thank you for hearing from me.
Number 2 out of the 15 signed up is Janet Settle. Go ahead.
Good morning from Abingdon, Virginia. I'm Janet Settle, and I do lobby work for Spearhead Trails and Heart of Appalachia. I'm here to talk to you this morning about Heart of Appalachia. The governor has a $100,000 amendment in the second year of the biennium budget. In 1993, the General Assembly formed the Heart of Appalachia Tourism Authority, giving it the mission to promote, expand, and develop the tourism industries of the coal-producing region. Heart of Appalachia is tasked with marketing small business attractions and communities to improve visitation numbers, which in turn increases the amount of meals, lodging taxes for the localities. The service area is composed of the coalfield counties of Lee, Scott, Wise, Russell, Dickinson, Buchanan, Tazewell, and the city of Norton. In 2019, the Virginia Tourism Corporation reports that the HOA service area generated $188 million in traveler expenditures, $41 million in payroll, 18,900 jobs, $11.8 million in state and local taxes. In the past, HOA received its funding from the Department of Mines, Minerals, and Energies from fines levied on coal companies. Because of the demise of the coal industry, these fines have dried up. In the March budget, HOA was included for an additional $100,000 in each year of the biennium. Then these monies were unallotted. After appeals from the Southwest Virginia delegation, the governor's staff has restored the $100,000 for the last year of the budget. The need is now greater more than ever for marketing outdoor tourism initiatives that have pushed the tourism growth in Southwest Virginia. Sadly, marketing funds are the last budget item for new startups, and Heart of Appalachia fills this gap. In the movie Field of Dreams, it was said, if you build it, they will come, but only if they know about it. And that's where Heart of Appalachia comes in. They're the know about it. Heart of Appalachia is the marketing engine behind the tourism, economic development, growth in our area, and we trust that you will again support this worthy project. I would be remiss not to make note that we in Southwest Virginia are heartbroken. The loss of Senator Ben Chafin is immeasurable. Many of you work side by side by the good senator and know what a fine, kind, honorable man he was. Ben loved his family and he loved Southwest Virginia. The senator from Russell wanted Southwest Virginia to be constrained neither by geography nor hard times. Those of us remaining will work hard to achieve that goal. God bless you all and thank you.
Thank you, Janet. And we certainly are going to miss Ben. Thank you for your presentation.
Thank you.
Number 3 is Janet Boston.
Yes, good morning. How are you doing? What an honor to be able to talk to you about our issues. Yes, my name is Janet Boston, and I live in Nelson County, Roseland, Virginia. I am a home care provider. Like me, I take care of older adults and people with disability, live where they want to live, at home and in the community. We save state money, $1 billion a year, because we're able to take care of our loved ones and keep them out of the emergency room or at home. We have been on the front line of this pandemic every day, keeping older adults and people with disability healthy and safe. We are called essential workers, but we are not often treated like essential workers. I don't know if you noticed, I had my sign up in my mask that says essential workers home care. I have been a home care provider for 10 years. I take care of my husband. I'm his voice. He's bedridden with Alzheimer's. I'm his voice. I do everything for him. He's bedridden. I take him to his appointments and everything. Like I said, we save the government a lot of money. I love being a home care provider. I didn't think this was ever going to happen. I didn't plan it. And I'm quite sure maybe some of y'all might understand this. It wasn't planned, but we do it. You do what you have to do to take care of your loved ones. And my family and everyone's involved. So when this happens to a loved one, maybe your loved one, my loved one, it affects the whole family and your community. But you learn to love it. You have to have a compassion for something like this. However, home care providers like me face serious challenges. My biggest challenge is we need you to start respecting us, protect us, and pay us. Here's what it has been like to be a home care provider during the pandemic. It's been hard. It's been scared. It's been going outside your home with your loved one and then coming back in your home and not knowing if you affect your loved one too. And I'm quite sure all of y'all are feeling that too. And not understanding, being in America, how come we are being treated like this? Home care providers are essential frontline workers, but we aren't always treated like that. That is why home care providers drafted a home care bill to advocate for what we need: living wages, paid sick day, and PE for providers, just like the state workers are qualified for care consumers. Thank you for funding the raises. Thank you for funding raises, hazard pay, and PPE last year. This funding literally saved the lives of older adults, people with disability, and home care workers like me. I'm here today to ask you to continue to support home care providers. We need real pay. We need paid sick days. We need PPE. We need an orientation program so that our home care providers can do their job well. We are asking you to fund our home care bill so that we can recruit and retain the quality of care for workforce that your constituents need to survive the pandemic. We're looking forward to working with you, but we want you also to remember, we just want you to respect us, protect us, and pay us. We deserve better. We are saving lives, and we're on the front of the line every day, risking our lives and our loved ones' lives. And you think that we just take care of our family, we take care of some of your families too. And we're just saying, let's be fair. We're asking for $15 for home care providers. It's sad to be making $9 and change to make ends meet, and it's not happening. People have to go from 3 to 4 people's homes just to try to make ends meet at $9.58. It's unfair, and we are saving lives like nurses and doctors. So we're hoping that you will fund our home care bill. We're hoping that you hear us and understand that it's us that's on the front of the line protecting our family and your family. And
Okay.
thank you.
Thank you, Janet. Good to see you again. Appreciate your remarks.
Oh, yes, how you doing? Yes, Senator. Thank you too. I'm always going to be whenever I can get a chance.
Next, number 4 speaker is Karen Conchar.
Yes, good morning. My name is Karen Conker, and I live in Midland, Virginia. I'm a retired county engineer, a mother, a grandmother, a voter, a taxpayer, and a proud union member. Currently, I serve as Secretary Treasurer of SEIU Virginia 512. For over 35 years, I worked for both state and local government, overseeing transportation improvement projects, completion of developer defaults, and many more of those types. I was proud to serve the citizens of Virginia by building strong communities where all working families, regardless of color of our skin, the language we speak, or the zip code we come from, can thrive. During the pandemic, public service workers have been on the front lines every day, keeping our community safe, healthy, and moving forward. I've been proud to support these frontline workers to gain access to PPE, paid leave, health care, and other vital needs. Public employees have been called essential workers, but we aren't treated as essential. We work constantly with fewer and fewer resources to meet the nonstop needs of our community, while struggling to keep our families and ourselves safe from the COVID pandemic. That's why it's so critical that we have a real voice on the job. I want to thank you from the bottom of my heart for repealing the ban on collective bargaining for public employees. This historic action ends decades of public service worker discrimination and brings Virginia in line with 47 other states. Collective bargaining means that essential public workers will have a real seat at the table to protect ourselves, our families, and our communities. Unfortunately, despite the start of the vaccine distribution, the pandemic is far from over. Cases continue to rise. Workers and our families will continue to be exposed to COVID-19 on the job and will need to quarantine in order to reduce infections is critical. Some schools are still being held virtually, and those working parents are faced with balancing those essential services with caring for their school-age children. Our healthcare systems are being stretched to capacity. I'm here today to ask you to do 3 things to help our communities get through this pandemic. Number 1, fund local government services provided by public employees on the front lines. Number 2, ensure paid sick days for all workers in Virginia, especially workers who currently have no paid leave options at all, like the home care worker that spoke before, Janet Boston. Expand collective bargaining rights so that every worker in Virginia has a seat at the table to stay healthy and safe. Thank you for taking the time to listen to me today. And we look forward to continuing the work with you to make sure we can all get through this pandemic together.
Thank you, Karen.
Number 5, Courtney Reese.
Morning, everyone. My name is Courtney Reese, and I am an intern at Voices for Virginia's Children. I'm here today to talk to you about the needs of children and their families as you all begin to work on the budget this legislative session. Families have been greatly impacted by the pandemic, and some examples include, of course, the well-known high unemployment rates, which are thus impacting parents' ability to afford childcare. We're especially seeing this. I know a couple folks have mentioned the frontline worker impact. We're noticing that this is impacting significantly those who have catch COVID. So looking at what they were just saying about paid sick leave, 1.2 million Virginians have no paid sick days, and 41% of private workers have no PTO at all. And along with this, more than 30% of African Americans have no savings and cannot afford the time off. So without those protections, families and children are at risk. Exacerbation of equity impacts are occurring in urban and rural communities, highlighted by what we're seeing in food deserts. So areas where we have no access to fresh and healthy food and produce, and families are best accessing, their best food access is fast food. So in 2015, we saw that 12.8% of US population lived in food deserts, and 1 in 10 households in the US prior to COVID faced food insecurity, with roughly 1,800,000 Virginians living in food deserts. This is a big problem that we see for our kids. So we really have a high need to foster a community level resilience. So what we would ask of all of you today is to expand paid leave options for parents. We want to protect these families and communities by ensuring that they can take that time off when they need it, especially as the virus is still a risk. We want to strengthen safety net resources for families through things such as TANF cash assistance, childcare subsidies, and SNAP nutrition benefits. And lastly, we want to make sure we can increase access to affordable and healthy food options in underserved communities. 2 methods for this is through the Virginia Food Access Investment Program, which allots funding to grocery stores, mobile hubs, farmers markets, and et cetera, to build in food desert communities. Thank you for your time today, and we look forward to your support.
Okay. Thank you, Courtney.
Number 6, Becky Wong.
Hello, my name is Becky Wong. I'm a mom with a disabled child and a strong supporter and advocate for home care workers. I am a member of a community, a voter, and a taxpayer. I live in Peony Spring, Loudoun County. Home care provider helps older adults and people with disabilities live where they wanted to live, at home and in community. Home care providers save the state money by keeping people out of the emergency room and out of the nursing homes. Home care workers has been on the front line of this pandemic every day, keeping our older adults and people with disability healthy and safe. Home care worker are called essential workers, like Jenny was saying, but they are often untreated as essential. I have been working with home care providers for over 10 years. I can't imagine what my life will look like without home care providers helping me. They has been helping me keep my son safe. They help my son with his meals, with his personal grooming, with his laundry, even take him to doctor appointments. And they do so much more. Because of them, I can work and keep my jobs. I love to advocate for home care providers because this is a job which we all will or we are need one day. Home care providers are so important for all of us. Here's what it has been looks like for home care workers during this pandemic. Some of them lost their job because people are afraid of the coronavirus. Some of them has been taking the risk to go work without the proper PPE. And their pay is still very low. Some of them make less than $10 per hour. So thank you for thank you for the funding raises, hazard pay, and the PPE from last year. This funding saved lives of older adults, home care workers, and the families with disability like us. I'm here today to ask you to continue support home care workers and the consumers in Virginia by funding the following items in this year's budget. Number one, the real pay increase for home care providers. 2, paid sick days. 3, PPE. The last, the orientation program so that home care providers can do their job well. Thank you. We're looking forward to working with you in Richmond this session to keep our community healthy and safe. Thank you.
Thank you, Becky.
Number 7, Jeannie Trabulsi.
Yes, good morning. I'm Jean Trabulsi from the Shenandoah Valley, where every day is a gift. Living among and with the people of the valley, neighbors who value loyalty to family, service to others, and above all, responsibility is a joy. One of the most memorable instances of these values in action came about when the engine of our car, Santa Fe, conked out on Interstate 81. Dazed and in disbelief, my husband kept pushing the start button, and I kept shouting, "Move over, pull over." As we came to the rest on the highway shoulder, with our car convulsing with those trucks bolting by, I became fearful that I would be rear-ended any minute and become a little hood ornament on one of those monster trucks. But minutes later, an angel appeared, an angel in the guise of Mr. John, who maneuvered his safety service patrol truck directly behind us and who ensured our safety until the tow truck arrived. This VDOT service was a gift to the value community from the General Assembly, and we thank you for it. Frankly speaking, we could use a few more trucks, but how to get the money? I've got an idea. How about removing from the budget the Virginia Israel Advisory Board, VIAB, at over 200,000 taxpayer dollars a year? Well, what is VIAB? On their website, they say that there's a state agency administered under the General Assembly that helps Israeli companies do business in Virginia. Furthermore, I understand it's the only lobbying group in the U.S. that operates within the state government. To me, it seems unfair in supporting VIAB. After all, the General Assembly doesn't fund an executive director or office space for the Asian Advisory Board or the Hispanic Advisory Board or the African American Advisory Board. To me, it seems unsustainable. What are you going to do when businesses from other countries want to create their own in-house lobbying group? Remember what happened last year when the Korea Advisory Board was tabled by the House Appropriations Committee? Laura Foe, who is the chair of an Asian American group in Virginia, said that in creating this independent advisory board for just one specific country is a big problem because it's preferential and it's divisive. In other words, the mere existence of a Korea Advisory Board or Israel Advisory Board pits the interests of one ethnic group against another. In summary, I've got one question and one ask. Was the General Assembly impartial in allowing the Virginia Israel Advisory Board into state government? And my one ask is to remove from the budget funding for the Virginia Israel Advisory Board, buy a few more trucks, and get them into Augusta County. Thank you.
Thank you, Jean.
Number 8, Nancy Kamajani.
Hello, and Happy New Year and good morning, legislators. My name is Nancy Kamajani, and my family and I live in Pilot in Montgomery County, Virginia. I also serve as an executive board member of the ARC of the New River Valley. I'm asking you today to fully fund Priority 1, which means funding DD waivers for those people waiting in crisis. I want to thank you personally on behalf of my daughter, Anita, and my family for your past support of the Developmental Disability Waiver Program. In 2018, my husband was diagnosed with melanoma, and I was recovering in a nursing home rehabilitatively from a horrific fall. My daughter, Anita, was finishing up her on-campus transition program at Radford University. She had been on the DD waiver list for 13 years. She was turning 21 and longed for a life of independence. That year, Anita received a community living waiver, which was the answer to our prayers. Because of this waiver, she was able to rent an apartment with 2 roommates, attend Project Search at New River Community Hospital, which taught her new skills and provided self-esteem as she excelled in each area. She volunteers at the county thrift shop. She attends bowling and social events with the Special Olympics. She has a social life. All of this is directly related to the waiver and the direct support providers made possible by the waiver. Through Anita's relationship with and tutelage of the direct support providers, she learned how to negotiate public transportation, shop and prepare healthy meals for herself, advocate for herself in all areas of her life. Anita works for the Montgomery County Public School System and receives a salary, budgets her funds, knows how to spend money now. Additionally, my husband and I are no longer consumed with worry for Anita's future, especially when we're not here to provide for her. Thank you again for your consideration of funding Priority 1. There are so many folks still waiting to have a life like yours. Thank you.
Thank you, Nancy.
Number 9, Reese Shearer.
Good morning, Senator Hanger. And
good morning.
Good morning, Senator Edwards and delegates. I'm Reese Shearer from Emory, Virginia, a retired educator, a member of Virginia Organizing, and most importantly, a grandfather. I served 16 years in Washington County as an elementary school counselor, a middle school dropout prevention coordinator, program created by the House of Delegates. And I worked as the only counselor in schools with school-wide Title I programs attending to as many as 425 students. Daily, I was confronted with the personal struggles of children living in poverty, whose life experience and access to minimal resources at home left them struggling. The additional $26.6 million proposed for counselors is very welcome. Yet, I assure you, it's not enough to meet the needs of all the students. In fact, state funding per student is below 2009 levels. By not fully funding SOQs, you leave teachers and staffs with an impossible job, yet a job required by the Constitution of Virginia, to which each of you has sworn your support. Article 1, the Bill of Rights of the Virginia Constitution states that free government rests, as does all progress, upon the broadest possible diffusion of knowledge, and that the Commonwealth should avail itself of those talents by assuring the opportunity for their fullest development by an effective system of education throughout the Commonwealth. And in Article 8, under education, referencing the standards of quality, our Constitution states the General Assembly shall seek to ensure that an educational program of high quality is established and continually maintained. Clearly, the buck stops here. The pandemic and its economic and social consequences are creating extraordinary stress, making it even harder for local governments to adequately fund public education. Our communities face a hurricane of distress. Adding to the rainy day fund now, as the governor proposes, is like stowing money in a bank for a child's college education, just as she's crying out hungrily for supper. Until Virginia equitably funds quality public education in every locality, regardless of wealth, our Commonwealth stands in violation of its own principles, and it's denying young Virginians their constitutionally enshrined right to assured opportunity for their fullest development. I ask you to stand for educational justice, fund in whole, not in part, the mandated standards of quality. The School Equity and Staffing Act filed by Senator McClellan and Delegate Aird will be a giant step forward towards funding equity. Thank you for the opportunity to share with you today.
Thank you, Reese.
As an update, Delegate Moorfield has a phone. The next speaker, number 10, George Rogers. I do not see him right now, although he was on earlier and has added some comments on the Q&A. If he rejoins, you can come back to him at the end. The next speaker, number 11, is Steve Grammer, and we have a pre-recorded video that staff will share via share screen for Mr. Grammer.
Okay.
My name is Stephen Grammer from Roanoke, Virginia. Caregivers need to make at least $10 an hour and have a COVID-19 relief package. Agencies pay anywhere from $10.50 to $13 an hour. $9.87 is not sufficient, especially when people can get paid more working at Walmart. Under Consumer Direct, most people will not work for less they get $10 an hour. If you do not raise the pay to $10 or more, people with disabilities will be forced into nursing homes, which will violate our ADA rights to live in a less restrictive environment. When you vote, I encourage you to think about giving people with disabilities a life like yours so we can have community life by giving a raise to caregivers and a COVID-19 relief package. Thanks for your time and consideration.
Number 12, Robin Mercado. Do not see that speaker either. Number 13 is Jim Best.
Good morning. I always learn something from these speakers. Shout out to Janet and Becky for their touting of the essential, wonderful help that home care aides provide. I've been a speech pathologist for 48 years, and I'm still working in home care hospitals in Withville, Stewart, Martinsville, and Galax. And I know firsthand, the first year I've ever been asked to buy groceries for my patients to help them with furniture, transportation, Virginians are hurting. It's the first and the worst I've ever seen in half a century of work. But year after year, I see the General Assembly investing hundreds of thousands of dollars to promote the lobby of one foreign country represented by the Virginia-Israel Advisory Board. As an official board of the Commonwealth of Virginia, VIAB has a privileged status with an implied endorsement of a single foreign interest. How does preferential treatment of another nation's businesses exemplify an impartial standard? How can the Appropriations Committee act independently or impartially when the VIAB actions require approval of the House of Delegates and Senate? Preferential treatment, implied state endorsement of a single foreign country with an official internal lobbying office is an inherently unsustainable precedent of favoritism that bypasses the regulatory process of the VEDP, which regulates all other investors and contractors in the public market. All of these incongruities are at odds with the principle of impartiality of elected members of the General Assembly, transparency in government, and accountability to Virginia voters. The track record of the VIAB is well documented in the Virginia Coalition for Human Rights website. There are audits and FOIA information listed there. My ask is that we promote local businesses for local Virginians, that we not continue to invest in an internal governmental lobby promoting foreign businesses by removing funding for the VIAB. Thank you so much.
Thank you, Jim. Appreciate your testimony.
Number 14 is Brad Harrison. Do not believe I see him in the room. And number 15 is Sarah Cariano.
Good morning, and thank you so much for having me. I am Sarah Cariano with the Virginia Poverty Law Center, and I'm here to speak on behalf of some policy priorities of the Healthy Healthcare for All Virginians Coalition. The HAVE Coalition consists of over 100 organizations dedicated to making Virginia a leader in offering affordable, accessible, and quality health insurance, health coverage for all in the Commonwealth. And this year, COVID-19 has really laid bare the disparities that do exist in our healthcare system and the disproportionate impact that has been laid within our Black, Latinx, and immigrant communities. And so as a result, we're really pursuing and encouraging you to look at some specific policies that would increase access to healthcare for the immigrant community, which obviously, increases community health and reduces community spread. First, we would like to extend Medicaid or famous moms prenatal coverage to women regardless of their immigration status. So currently these births are covered by emergency Medicaid, and we actually get a lower reimbursement rate for the birth through emergency Medicaid at the federal level than we would through expanding it to cover prenatal coverage and getting the CHIP reimbursement rate. This was also a suggestion in the DMAS budget package. So it is something that they are ready and willing to do, submitting a state plan amendment to be able to take this option up, as 17 other states already have. And also DMAS has estimated that it will save $2.3 million to actually just provide better care, but getting the larger federal match for that care. And so it provides better care. It sets these children up for more, better health throughout their lives, and it also saves the state money. Unfortunately, it was not included in the governor's budget, but we hope y'all do take a serious look at it and include it in your budget. Next, we'd also like to clarify that emergency services Medicaid does cover COVID testing, treatment, and screening and the vaccine as well. This is for folks who, only qualify for Medicaid within an emergency circumstance. Many of these individuals avoid care and could avoid costly COVID care even if they are ill. And so we just want to make sure that folks feel comfortable accessing care. Again, preventing community spread, because if you're getting, screened and tested and treated, you're not continuing out into the community. And lastly, we'd like to increase the age for legally residing immigrants to qualify for Medicaid. Currently, it goes up to age 19. Again, this is a federal option that the state can choose and expand that coverage up to age 21 and just get these young adults kind of a better, healthier start. So thank you again for your time. I think I am your last speaker, so Happy New Year, and I hope you all enjoy the rest of your day.
Okay, thank you, Sarah. Okay, Sarah, we got more speakers queued up.
She was 15, and that is the one that you had signed up. There were the three that were not here at the time and do not appear to be in the attendee room currently. It was George Rogers, Robin Mercado, and Brad Harrison. They may have opted to submit comments in writing via the website.
Okay. I don't know if you need to check back with our controllers at IT, but let's see. Any of my colleagues online here, Delegate Hurst, you were co-chairing this. You got any comments, or if you're still available?
Well, Senator, I appreciate the opportunity to be here and to listen to the concerns that so many have, especially in our healthcare industry. And I hope that soon we'll be in a position to address those needs in a meaningful way. So thank you very much for the opportunity to be here to listen to the public comments.
Okay, good. Any of my other colleagues have any closing comments? Okay, Sarah, have you had an opportunity to double check, make sure we don't have anybody trying to get into the room?
I did, and IT reports that there's nobody that currently is trying to get in, so that is
okay. All right, with that, I want to thank certainly my colleagues for being available to us for this very important budget hearing today. I want to thank staff, which I see all of you all there, that have organized this so efficiently for us, and appreciate all of you all keeping us straight here this morning and organizing this. And I know you've taken notes, as I did, because there are some very important messages that were delivered here this morning that we will need to be following up on. With that, if no one else has anything for the calls at the moment, I would declare the budget meeting closed. Thank all of you.